Making sense of pain is an important step in managing pain and moving forwards in life. First off, pain is very real, but it's subjective, it's an individual experience. And there's different types of pain. Acute pain after an injury we can all relate to. Chronic pain tends to last longer than 3 months. And neuropathic pain arises with damage to the nervous tissue, and it has a characteristic burning quality to it. And you can get a mixed component where you might get little bits of all those types of pain. And it's important to know what type of pain you're dealing with, because they all require different management approaches. So let's look at the key differences between acute and chronic pain. In acute pain, it's after a history of injury, so most people are familiar with it. The nervous system is operating normally here. There's localised pain with clear diagnostic signs like swelling or bruising. It lasts for a set time and then resolves as tissues heal. Rest helps in the early stages as part of the protective function, and pain and function will improve during the recovery period, so the outlook is very positive. Let's contrast that to chronic pain. Nervous system may be creating unhelpful messages now. The pain is more widespread and variable signs. The pain is persisting longer than the healing times of the tissue, so we're looking at longer than 3 months. And in this case, too much rest is not helpful because it can lead to deconditioning of the body. Pain persists with a greater impact on life as time goes on. Let's look at this graph in more detail. The vertical line is intensity and the horizontal line is time. We know pain persists over time, but the intensity can vary. It can go up and down. That's the top line in blue. If we look at the green line, that's coping skills. And to begin with, you think it's going to be acute pain, it's going to resolve, it's going to get better. So your coping skills are high, but over time they start to reduce. As that is happening, distress will start to build up because pain is impacting on more areas of your life, and the suffering that comes will increase. So let's try and understand pain a little bit further. If we take a historical perspective, you'd be surprised to know right back in the 17th century, Descartes actually depicted an experience of pain. In this picture, somebody has their foot in the fire and it's sending a message up to the brain. So this is depicting a one-way transfer of information from the body to the mind, and this has created this viewpoint of dualism, the mind-body. You can see that the site of pain is easily linked to the cause of pain, and it's associating pain with tissue damage. But we now know that this is a very narrow perspective and is not so helpful. Research studies and brain imaging techniques are allowing us to gain a greater understanding of pain mechanisms. So let's look at acute pain in more detail. This relates to the physiological process of nociception, and this is the protective function of the central nervous system to avoid injury. So the central nervous system comprises of the brain and the spinal cord, and then nerves are coming out from the spinal cord to the periphery, and this is the peripheral nervous system. So what's going on in this case? We have sensory receptors down in the tissues that are picking up messages. They're picking up any noxious stimuli that occurs. So for example, temperature, chemicals or pressure. And it will then transmit signals up towards the brain. The brain is then organising what to do with that information. And so an output will be a perception of pain. And pain is very well designed. It's unpleasant, it's distressing, it makes us take notice. And that will lead to different behaviours that will help to protect us. So for example, removing the limb from danger, adopting a protective posture, and maybe resting to allow the tissues to heal. But that's not explaining the subjective variations that we can have in the pain experience. So something is going on here, and we know that things are being dampened down at spinal cord level. For example, somebody might have very severe injuries, but they actually look quite stoic. They don't have a great perception of pain. So what's going on here? Something has gone on in the brain to dampen down the signals coming up. And so the perception of pain has changed. We also know there's an emotional component to it. If you're a parent, you'll understand if your child is in danger, you focus on them first and you might not notice the pain that you're feeling at that time. That might come later on. Perception of pain is not just related to sensory input. Often people feel really confused because the MRI findings don't indicate anything, but their perception of pain is very real. So they can feel very confused at this point. But we know that there's not a strong correlation between MRI findings and the perception of pain. But we do know MRI findings are very useful in ruling out red flag pathology that needs urgent treatment. So let's look at the mechanism of chronic pain. Chronic pain is not just acute pain mechanism lasting longer, it's totally different. The central nervous system is operating in a different way and other protective behaviours emerge. If we look at the output of pain, pain is still there even though the tissues might have healed. So other types of behaviours start to emerge. Fear of movement is a big factor for a lot of people, and it leads to anxiety and maybe avoidance of other activities. We also tend to notice poor sleep is a big factor for people with chronic pain. That can influence mood, and depression can sometimes emerge. So in this case, multiple parts of the central nervous system are now working together to organise this greater output. So it's not just pain, it's all these other factors that have been influenced within the brain. Pain is a perceptual experience and it involves different systems of the body working together in a coordinated way. And from the research, we now know it's not just the central nervous system, the endocrine and the immune system is involved as well. We often tend to focus on the sensory component because that relates to our body, it's visible, we can understand it more easily. So sensory information is being processed in the somatosensory cortex, but we then know that other parts of the brain are involved. The emotional centre, the limbic centre, is involved within that perception of pain. There's an emotional component to pain. But there's also a cognitive component because we're trying to make sense of our pain experience. And so there's a lot of decision making going on in relation to threat. And that's all happening in the prefrontal cortex. But we're not just a body on its own. We live within an environment, we live within a society and a culture. So we have all these other influences as well on the experience of pain. So in chronic pain, the healing has happened within the tissues, but the output of pain continues. So is something going on? Has the central nervous system become sensitised? So the brain has the ability to dampen down incoming sensory input, but this regulatory system can also work the other way. Cognitive and emotional factors can act as an amplifier, and so they can amplify those signals instead of reducing them. So for example, we know stress can have a big effect on pain. Pain is very stressful. Stress levels increase pain. We also know there's an emotional component. Fear is a big factor that can amplify the experience of pain. Our thoughts can also play an influence, and maybe those memories and beliefs we have around pain from our life experiences. So all of these factors will act as amplifiers within the spinal cord. The brain is trying to make sense of the information. So if it's now being amplified, the threat risk will be put at high. If the threat risk remains high, the perception of pain will be heightened. And no wonder we're more likely to stay in our comfort zone or avoid activities that we think might increase our pain. If central sensitization is occurring, certain signs tend to show. Pain can often come on with no warning. The region of pain is spreading. Old injuries may start to hurt again. Negative thinking can easily wind up the pain. You might notice your pain changes quickly depending on your mood or stress levels. Your body often feels different and it's hard to get moving. And you might become hypersensitive to different sensations. So not only touch, you could become sensitive to noise and light. Can you relate to any of these signs? How many ticks would you put on this list? Could there be a component of central sensitization within your pain experience? The brain is not fixed, it's constantly making changes and developing new pathways. So it's plastic and it's known as neuroplasticity. So if the brain is connecting and making new pathways over time with pain, you might then find that less input is required to gain the same output. So in a sense, the longer the brain is producing pain, the easier it becomes to produce it. But we can also use neuroplasticity within rehabilitation, because if we can focus on repetitive actions towards desired and valued goals, new pathways will be formed, and then these will become automatic, and the older pain pathways will lose their strength. So let's summarise what we now know from research studies. Pain is a subjective experience in response to making sense of input and perceived threat. Other factors can amplify signals that heighten the brain's threat appraisal system. Chronic pain is therefore not an accurate measure of tissue health. The longer the central nervous system is producing pain, the better it gets at producing it. As pain persists over time, it's less about tissue damage and more about the things that are making the central nervous system sensitive. So we need to have a look at reframing our thoughts going forwards. Searching for the cause and seeking the fix to remove chronic pain can seem like meeting a brick wall. A lot of frustrations build at that point. Instead, what about redirecting efforts and working with supportive pain specialists? Because that can be like opening the door to possibilities. This will involve developing an individual pain management plan. Pain management involves making sense of the individual subjective pain experience. It will involve identifying factors that can amplify or soothe a sensitive central nervous system. It's about regaining confidence to exercise and improve function. It involves returning to meaningful and valued activities. And if you like, if we can change the input, we can look at changing the output. This is an in-depth, ongoing process. It will take time and people will progress at different speeds. I leave you with some reflections of what other people have said.